On top of our stories, PFIZER-BIONTECH COVID-19 vaccines arrived in Ninoy Aquino International Airport. DOH detects an Indian variant of COVID-19 in the Philippines. OCTA research suggests extending MECQ and NCR Plus until the end of May. Malaysia imposed a new national lockdown. WHO Foundation launches a fundraising to help the India amid the surge of the COVID-19. Good evening, my name is Alvin Pelobello and this is Eurotv World News. President Rodrigo Duterte signed a proclamation number 1142 declaring May 13 Thursday as a regular holiday throughout the country in observation of the EID'L FITR or the Feast of Ramadan as recommended by the National Commission in Muslim Filipinos. Proclamation also says that Filipinos should have the full opportunity to join the Muslim brothers and sisters in peace and harmony in the observance and celebration of EID'L FITR, but subjected to community quarantine, social distancing, and public health measures. After several months of delay, more than 193,000 doses of PFIZER-BIONTECH COVID-19 vaccines from COVAX initiatives has finally arrived in the Philippines. Here's the details from 𝗪𝗓𝗪.
PFIZER-BIONTECH COVID-19 vaccines has finally arrived in Ninoy Aquino International Airport Terminal 2 on Monday night. According to the Department of Health, more than 193,000 doses of PFIZER-BIONTECH vaccines from COVAX initiatives were mainly allocated for Metro Manila, Davao City, and Cebu City. 68% or 132,210 shots of the initial shipment were allocated for Metro Manila. Cebu City and Davao will receive 15% of the shipment, that is almost 29,250 doses for each. However, Quirino Province will now receive 1,710 doses, while the remaining 1,710 doses serve as a buffer stock, due to the requirements set by Vaccine Czar Carlito Galvez Jr. Health Secretary Francisco Duque III said that within a year, the Philippines is also set to receive 2 million doses of Sputnik V vaccine, 1.1 million doses of Pfizer jab from COVAX facility, and 500,000 doses of Sinovac vaccine. 𝗪𝗓𝗪 for Eurotv World News.
The Department of Health on Tuesday has detected 2 cases of Indian variant of COVID-19 in the country. It was reported by the World Health Organization based on some preliminary studies that B.1.617 COVID-19 variant spread more easily compared to other variants. Cases were confirmed in 2 overseas Filipino workers who returned in April from United Arab Emirates and Oman. According to Epidemiology Bureau Director Althea de Guzman, 2 OFWs undergo quarantine and no close contact has been reported yet. They both have a travel history in India but have been reported as recovered. The Philippines had set travel restrictions from countries such as India, Pakistan, Sri Lanka, Nepal, and Bangladesh. The OCTA Research Group may suggest extending the MECQ Modified Enhanced Community Quarantine until the end of May, as they have seen a big impact to lessen the COVID-19 cases in the country. Based on the data of the OCTA Research, the average daily cases of COVID-19 has dropped to 2,347 from May 1 to May 7, 2021. Data may still drop until the stipulated last day of the MECQ on May 14. But the group said that if they will prioritize the health instead of the economy, it should be extended until the end of May. They said that it is more than a 50% decrease compared to a peak of the cases from March 29 to April 4. Despite of this, there are still some provinces that have the increase in COVID-19 data due to the relaxation of the travel restrictions in February. Based on the latest data of the Department of Health, the Philippines now had a total of 1,113,547 COVID-19 cases as of May 11, 2021. With 56,752 active cases, 1,038,175 total recoveries, and 18,620 total deaths. Bureau of Fire Protection fire truck of PATEROS accidentally hits a woman while walking on a pedestrian in Barangay Magtanggol after responding into a quarantine facility. Let's get an update from our news correspondent, Warren de Guzman.
PATEROS City Bureau of Fire and Protection fire truck was on its way back to the station after responding to a quarantine facility. Hits a woman walking on a pedestrian lane. In the video shared by the authority, it was first almost collided with a car and a motorcycle before it hit a girl walking on a pedestrian. 30-year-old Denitiar was hit by the fire truck. Her right eye was damaged and might be removed because of what was happened. Meanwhile, the driver of the said fire truck, Fire Officer 2 Ramon Lactao II, is now detained at the police station. According to the authority, the driver is not drunk based on the result of the medical examination. In an interview with Chief Inspector Carl Blando of Bureau of Fire Protection PATEROS, he said that there is a human error in the incident. BFP PATEROS promised that they will help the victim until she is released from the hospital. This is Warren de Guzman for Eurotv World News.
Japanese Prime Minister Yoshihide Suga said that he will never put the Olympics first, but rather prioritize protecting the lives and health of the Japanese population. Suga also insisted that they must first prevent the spread of the COVID-19. This is despite the poll that showed nearly 60% or more than half of people in Japan wants the game to be cancelled. Based on the opinion survey conducted on May 7 to 9 by the Yomiuri Shimbun Daily showed 59% of the respondents wants to cancel the games, compared to the 39% who said it should be held. But the postponement was not offered as an option, as the International Olympics officials, Tokyo planners, and Suga have insisted that the games will go on in a safe and secure way. Japan has extended the state of emergency in Tokyo, a place where the Olympics will be held, along with 3 other areas until the end of May, as they struggle to contain the surge of the COVID-19 cases and behind its vaccination rate were lowest compared among other wealthy nations. World Health Organization or WHO Foundation together with the India Appeal launched a fundraising to support the WHO's works in India that includes purchasing of oxygens, personal protective equipments, and medicines.
Today, the WHO Foundation is launching the Together for India appeal to raise funds to support WHO's work in India, including the purchase of oxygen, personal protective equipment, and medicines. To donate, go to who.foundation and look for the black donate button and select the Together for India appeal.
India's Ministry of Health still recorded more than 300,000 new infections within 24 hours. The country now had a total of 22,992,517 people who got infected with the virus, while the death toll climbed to 249,992. Several states in India had imposed lockdown to contain the spread of the virus, but India's Prime Minister Narendra Modi has been battling for criticism after allowing huge gatherings such as religious festivals and even holding large rallies a few months ago that the opposition seen as the main reason for the surge of the COVID-19 infections. In a press briefing, WHO admitted that the relaxation of public health protocols and social measures drives the transmission of COVID-19.
We're still in a perilous situation. The spread of variants, increased social mixing, the relaxation of public health and social measures, and inequitable vaccination are all driving transmission.
For more news updates, you can visit www.eurotv.ph, Eurotv News on Facebook and YouTube. My name is Alvin Pelobello, and this is Eurotv World News.